So one of the questions I get most often is, what is functional medicine? And fundamentally, it's looking at identifying the underlying causes of disease, which seems to be fairly intuitive, but it's not necessarily how medicine is practiced all the time. In traditional medicine, I was always trained to look for the diagnosis, with the thought that if we had an accurate diagnosis, we would know what the appropriate treatment would be. And that works really well in an acute medical issue. So if you have somebody who's septic and they have a bacterial infection, if we can identify that infection, the specific bacteria, we know what antibiotics to give and the patient gets a lot better. But that starts to fall apart when we start looking at patients with chronic disease that have multiple contributing factors. And there's a whole host of chronic diseases, whether we're looking at migraines or chronic fatigue or depression or eczema. And those are typically caused by numerous things. And so just giving somebody the correct diagnosis of depression doesn't really tell you what's the best treatment they're going to respond to. And if you look at this, we have an awful lot of conditions where a single diagnosis can be caused by multiple problems. So for example, obesity, that can be associated with hormonal imbalances, with inflammation, with diet and exercise, with mood disorders. And you need to understand where that's coming from in order to come up with a treatment approach that's going to work for that particular person. On the other hand, you can diagnose somebody with something like depression or arthritis or diabetes, and those are all different diagnoses, but they can all be coming from the same root cause, something like inflammation. And so then we have to figure out what are those underlying causes to help people get well. And in functional medicine, we really focus more on looking at those root issues. And we assume there are certain physiologic things that need to happen in the body to set the stage for health and wellness. And that includes things like assimilation. Can you pull nutrients out of your food? Can you absorb them and incorporate them into the body? Defense and repair. That would be things like the immune system being able to defend you against infections and other parasites, that type of thing, and also to repair any sort of tissue damage your body's accumulated. We want to make sure people have sufficient energy production at the cellular level. And so that's going to include the cells and all the tissues in the body. You need to be able to transport nutrients and messages, things throughout the body. So that includes transporting oxygen through the bloodstream. It includes transporting inflammatory cytokines or messages or hormones, either throughout the bloodstream, or in some cases, we're transporting things through the lymphatic system, or we're pulling in signals from a site of infection back to the immune system so the immune system can gear up. Looking at structural integrity in the body. So there's a lot of just basic things that need to work right. And that doesn't fit into the classic criteria of, cardiology or pulmonology or gastroenterology. And I think looking at those is really helpful. Then we also look at, even more fundamental to that, are things like, it's the patient able to manage their stress? Do they have social relationships that help support them as a person? Are they able to move and get around and get some sort of activity? There's a lot of basic things that I think are really fundamental as a groundwork for health. And Jeffrey Bland really described this very well in his book, The Disease Delusion. In there, he talked about the idea of salutogenesis. And this is the creation of health. So studying, what do we need to do to help somebody to get well, which is sort of the opposite of what I studied in medical school, which was pathogenesis, or what are all the things that can go wrong and how do you identify them? And I really like that idea of studying health and wellness, because if you can improve someone's overall health, then the impact of disease should diminish in their body. I think this is really useful when you look at conditions where we don't have great treatments on the conventional medicine side. So think of autoimmune diseases like multiple sclerosis or dementia and cognitive decline, various irritable bowel syndromes and IBS, mental health disorders, long COVID, fibromyalgia, autism is a big one. And when I hear about cases like that, and I know that our treatment modalities are somewhat limited, and then you hear people who get miraculously better, I always wonder, well, if if they got better in a situation where we thought that wasn't possible, then what is new and different? And this is a picture of Terri Walls. She is a physician who had multiple sclerosis that was really severe, advancing, and she had exhausted everything we knew to treat her with on the conventional medicine side. And so she started just trying anything else she could think of. And this was a lot of lifestyle interventions. It was a lot of support for mitochondrial function and for the muscle cells themselves. And she kind of had nothing to lose. So she was experimenting on herself, and she managed to put together a protocol that allowed her body to heal. Now she is world renowned and lectures all over the world teaching this kind of integrative approach. They've since done research studies using her protocol on other patients with MS who also have improvements, and they're looking at that with patients with other forms of autoimmune disease. Excuse me. So I don't think it's just MS, but it makes you stop back and take notice of what is different and what worked. In the same way, you can look at the work of Dr. Dale Bredesen, and he did a lot of research into cognitive decline and ultimately found that cognitive decline is a result of many, many different factors simultaneously. And he has identified about 36 factors that all contribute. But the goal is, if you can intervene on as many of those as possible, can you then start to get reversal of that cognitive decline? And he has demonstrated that over and over now. And there are multiple publications, scientific publications, as well as his regular books that are more for the lay public. And I was always taught, dementia is a part of aging and it just happens and there's nothing we can do about it. But clearly there is. I think the body has a lot greater ability to heal and recover than we originally appreciated. This is just some research of his, and his protocol is called the RECODE protocol. It's reversal of cognitive decline. And they were comparing that to the results of several of the FDA approved medications like aducanumab and lecanemab. And all of these FDA approved drugs have only ever shown to decrease the rate of cognitive decline. So if on this scale, they're looking at objective scales of cognition, so you can measure cognitive decline. And without any treatment, we expect that people will deteriorate. And with this pharmaceutical-based treatment, we can decrease the rate of that decline, but it's not a substantial decrease, and it really only pushes the ball down the road a few more months. Whereas when patients implement his protocol, which is a much broader protocol and is effectively a functional medicine protocol, you actually get improvement in cognitive function. I think that's really astounding. So in functional medicine, we're looking at all of the different factors that I think contribute to health. So whether it's nutrition, we're looking at stress management, we're looking at the systems that the body uses to clear toxins, we're looking at gut health and making sure the microbiome in the GI tract is working, that you're absorbing your nutrients. We're looking at movement, sleep, and social interactions. And all of that combined helps to create a healthier person. We also look at what makes people unique. And I think this heterogeneity is lost in some of the traditional models. I was always taught evidence-based medicine. Let's do a trial. We'll get a large group of people together and do a randomized placebo-controlled trial where part of the group gets one treatment and part of the group gets another, and then we'll look at the differences. Well, that assumes that patients are all sort of similar to each other. But I think there's actually a lot more heterogeneity that makes that harder to study in that research modality. And imagine you have a room full of patients or people who all are exposed to the same thing. Take a COVID infection, and everybody gets COVID, and most of those people recover after a week or 2 weeks, and they're back to work and their life goes on as usual. And you have a handful of people that seem not to get better, or they seem to have these ongoing symptoms. And the question is, what's different about those people at the time of that exposure that caused their body to react so differently? And this happens for all sorts of triggers, whether it's food triggers or allergies or chemical exposures or infections. And patients really do act differently. And then they act differently in different ways. And so you need to understand what is unique about those patients to come up with a more precise protocol. And that's where personalized medicine comes in, because we're going to take into account things like the patient's own life experience, which is going to be different from patient to patient. We'll look at the environment that they're living in. We'll look at their social connections. In some cases, we can look at genomics and see if there are genetic weak points or susceptibilities that have been impacted and are causing this change in the way their body's reacting. And so I hope that gives you a sense of kind of the global idea of functional medicine. I go into a lot more detail into some of the specific factors that we address. So these may be some other helpful videos, but it was great. Thanks. Bye-bye.